Hello everyone. مساء الخير. اليوم عنا لقاء حلو كتير مع دكتورة ليا أنتونيويتز، أخصائية النسائية والهرمونات والصحة العامة للنساء. فاليوم كلامنا كلياته رح يكون عن الصحة العامة وكيف نحافظ عليها طبيا وذهنيا أيضا. ورح نتكلم كتير على الهرمونات ومدى تأثير الهرمونات النسائية على حياتهم اليومية وعلى المدى الطويل من الحفاظ على صحتهم العامة. رح نتكلم أغلبا بالإنجليزي، اللي عنده سؤال بالعربي ممكن يسأل. إذا بدكم استفسار عنها بالعربي ممكن تسألوني، بس الدكتورة رح أتكلم معها مباشرة، رح يكون باللغة الإنجليزية. دكتورة ليا من هيوستن تكساس، أخصائية النسائية والصحة العامة للنساء، رح تشاركنا هلأ معنا فيديو لايف. هلو
Hello, how are you, dear friends?
Good. I'm very thankful that you are joining us today.
Oh, I'm delighted. Thank you.
Hopefully we can reach out to as many women as we can to address the point we want to bring up for them in this live video.
Yeah.
So Dr. Leah is from Houston, Texas. If you want to tell us briefly about yourself, Dr. Leah.
Oh, sure. Well, I have lived in Houston for about 20 years now, so I will say that I'm from here. But I was born and raised in Texas. Actually, my background, my mother's Lebanese and my father's German and Native American. I went to medical school in Boston, started residency in Colorado, and finished out in Houston. I've been here ever since. I was an OBGYN, practicing mostly in academic medicine, which meant that I also taught residents and students and even doctors and nurses. But for several years, I saw a gap in traditional medicine here in the West and wanted to be more of an integrative doctor and use food and lifestyle and other remedies to help people, women in particular, and also saw that there was a huge need for midlife and menopause medicine. So that is how Abir and I met.
Absolutely. I'm a patient as well. I'm a very happy patient, let's say. So I want to ask you, normally, since we're talking women here, we always talk about women health. We talk about general checkup. And from my experience working in the healthcare system, just working with women to have their general exam, it usually covers a general lab test, a pap smear, a mammogram at max, and that's what I would call, as for me, what a gynecologist will be looking at, or a family medicine who's checking on my health.
Mm-hmm.
So, but being in healthcare, I know it is way beyond just that. Yes, maybe this is basics, but there is something more into that. We are growing older, our body is changing, our sleep is changing, our mental health is changing. So I want to know, how can women ongoing check on all this as well? Because this is not a mammogram test, this is not a pap smear test. So I think no one will say this better than you.
Well, yeah, absolutely. We'll try to say it the best. This is another area where, unfortunately, traditional medicine can be very limited because we're only given a certain amount of time to spend with patients. So sometimes we just do some kind of limited things, which might be a breast exam and a pelvic exam, and then here's your mammogram, and here's some labs, and not even do what I consider a complete set of labs that look at inflammation and insulin resistance, but also don't have the time or not given the time, even though we want to, talk to patients about all of the other very important things like you just alluded to. So, I have what I consider 5 pillars to be important to health, and it's in a scanner method, and that is spiritual health, connections that are meaningful, activity, nutrition, and rest. And I could spend an hour talking about any one of those things, not to mention, the examination and whatnot. But So those are important things for you to actually bring up. You know, I would go to your appointment saying, gosh, these are my top 3 concerns, and let the provider know that you want to discuss these things, and you take charge of your visit because it is your health. And as far as the labs, you know, we can get into that into further detail, but definitely feel that a typical panel of labs is kind of limited, and it's not looking at things like inflammation in a deep level. It's not looking
Why
at
do we have to look at the
micro
inflammation? Just a question. Why do we have to look into inflammation?
Inflammation is chronic inflammation is the root cause really of all disease, including cancer, dementia, diabetes, weight gain. A lot of patients that I see, they are gaining weight because they have high cortisol, high inflammation in their gut. I mean, I could go on. So that is really where it starts.
So, checking on this, at least to have more intense look into our labs, including those additional testing, will give you an impression to how am I doing at what I may need, right? Including my lifestyle, what I eat, what I do on daily basis.
Absolutely. So, you know, I can interview you as a patient and find out what's going on in your life. And then I take the labs and I look at that, and I see what matches up and what doesn't. Not everything can be tested in the blood. Sometimes we have to guess. Sometimes we need different tests. We need stool samples or hair samples, or we need CTs of the heart. We need ultrasounds. You know, there's different things that I might need, but I definitely start there, and listening to you and really delving into what's going on and taking a really good dietary history, for example, can be very, very helpful in elucidating what's going on or what you need to continue doing that's right.
That's true. That's true. So, what is the main role of nutrition that plays to affect our hormones? I know it's going to affect our health in general, but it's going to affect our hormones, and then it's going to affect our health, right?
Oh, absolutely. So that's we could break that down in kind of 2 different ways. So since we're talking about inflammation, we could start there. You know, if we have inflammation, our hormones, and when I say hormones, we have a lot of hormones, not just testosterone, estrogen, and progesterone. Thyroid hormones, vitamin D is a hormone, adrenaline is a hormone. So there's a lot of different hormones in our bodies. But when we have inflammation in our bodies, those signals are not allowed to go to the cells or activate the cells the way they should, because it distracts things. It kind of wreaks havoc, I'll say. So just not eating an inflammatory diet is a very good place to start. And most people have no idea what that means, or don't understand how that happens. So eating minimally processed or unprocessed foods, for example, the more ingredients that's in something, if there's more than 5, and certainly if you can't pronounce it, choose something different. Having high quality food is very, very important. You know, grass-fed, pasture-raised, wild-caught, how long that it took it to get from the store to your house. All of those things are very important. So those are some basic things, but also the exact nutrients that you have are important as well. Zinc and selenium are important for your thyroid. Iodine, 97% of Americans are deficient in iodine. In fact, people worldwide, unless you live in Japan, are often deficient in iodine. Iodine literally makes up your thyroid hormone. It does far more than that, though. It helps prevent cysts, fibrocystic breast disease, breast cancer, cysts in any gland, pancreas, uterus, prostate. I could go on. It's very important, and a lot of people just don't even realize that they're not getting enough iodine because our government put it in table salt, but a lot of us don't eat that, or we don't eat salt very much, or we're eating Himalayan pink salt or sea salt and things like that. So
yeah. So nutrition is really important to have a good start. But I want you to lead. You tell us what is it that we need to look into into our general health as women after a certain age, especially when we hit menopause.
You know, we'll just say 40 and up. One of the things that becomes really important for us is protein. Our metabolism changes. And so I'm just going to assume that most people are around 70 kilograms, whether you are or not. But let's just say you need a gram per pound of protein a day. So that's a lot.
It
That's a
is.
lot. That's a lot. That's a lot. Trust me, I try to choke it down most of the
I
time.
try
I don't meet
to.
my
It's very
goals.
hard.
I don't meet my goals, but so I start with protein, and I start like for today, for example, I had a 4 egg scrambled with some mushrooms, a very high protein breakfast mid morning to break my fast. When I do, and then I add in my vegetables or whatever else it is, because honestly, I often don't have room for much more. And when I do eat carbohydrates, and I do eat plenty of carbohydrates, I do try to make sure that they're low glycemic. And what that means is that it's not going to raise your blood glucose and your insulin levels. Insulin is the hormone that carries the sugar across to your cells where it's needed. And if it gets too high, though, then we go into something else, and high cortisol and inflammation. And that's how that works. So if we have consistently high glucose levels and high insulin levels, the body starts doing things that are a little differently. And so it packs it away as fat, thinking that, oh, we're going to use this later on when Leah goes on a 3-day trek hunting for food, or when Leah is going to run from a bear, because our bodies don't know that we live in 2024 and then I can hop on Uber Eats and get food.
Yeah, true, true. So let me ask you, when women say like they're having a brain fog, what do you translate that to?
Oh gosh, that can be so many things, Abir. That can be hormonal deficiencies. It can be nutrient deficiencies. It can be low sodium. It can be inflammation. People can have leaky gut. People can have gut dysbiosis, which is an imbalance of good and bad bacteria. That is actually the #1 cause reason for brain fog. It can be poor sleep. Boy, in midlife, we struggle with our sleep. Of course, we have our careers and children, or what, we're taking care of the household, you name it. So we're super busy and we're stressed. But also our hormones begin to fluctuate, and we go through reverse puberty, and it wreaks havoc on your sleep cycle. Guess what that does? That increases cortisol and inflammation, and it's that vicious cycle. So brain fog can be caused by a lot of things. That is something that has to really be investigated with not only a history, but lab tests as well.
And it can be reversed. If there is no medical issue that you find, then can we reverse it?
Absolutely. I have people come to me, and we improve their brain fog all the time, especially when we just help them sleep.
Yes. I know your time is like by 10. We should be sleeping by 10 p.m., right?
Yes.
Or earlier. Is it earlier or 10?
I
I
mean,
can barely
it
make
depends.
it. I'm
If
trying.
you're truly a night owl, which is totally fine, then that's fine. But you need a time. You need a set. It's more important is a consistent bedtime and a consistent awake time, because then your hormones, growth hormone, cortisol, all of those things are regulated appropriately. So it's about consistency.
I see. Of course. I mean, so sleeping, eating, what else that can affect our general health that you look into when you're checking
So your stress levels, so this goes back to the scanner method. Your spiritual health is very, very important. Do you have a daily routine where you can recenter? And spiritual health can include religion, but it doesn't necessarily mean religion. It's just spiritual for me. Being outside in nature, going for walks with a friend, that's actually a 3-for-1 way to decrease your cortisol. Activity outside with a companion. That companion could be a dog or a cat. It could actually be talking to a phone on the friend as well. So spiritual health is important. It may be gardening. It may be watching something grow. It may be service work, helping a friend, calling someone and supporting them. So all of those things decrease cortisol. And taking little breaks, taking a break every 90 minutes at least, maybe saying a meditation or an affirmation, or just getting up and walking around. Those are all things that help us recenter and decrease cortisol as well. As long as spiritual health guidelines, saying affirmations, writing things that you want to accomplish on a mirror. For example, focusing on what you do want instead of what you don't want, and not letting your fears guide your decisions, and focusing on, I want to do high intensity interval training for 10 minutes because it's going to decrease my stress and help me sleep. I'll feel good about myself, and I'll feel better about my life. So instead of, oh, I'm tired, I don't want to do that.
Yeah.
For example.
So it needs to take the extra step.
Yeah.
We need to make that extra step. Absolutely. Absolutely. So again, we're saying that our hormones affect the quality of our life. So everything is in a chain related to each other. There is nothing separated. Nutrition, stress, sleep, general health, it's all connected to our lifestyle after all. But it's just if I'm feeling okay and I don't have any issues, that still doesn't mean that I am fine. We have to look more into how we can improve for prevention. We talk about prevention a lot, but we're not making any steps towards how can I prevent me after 10 years having something that I can control, like diabetes, heart disease. There's things that's out of our control, but at least whatever we can control to try to prevent it. Prevent anti-aging. I mean, it's anti-aging. Well, how can I do more for anti-aging to continue to look good and have good skin and good weight, managed weight? How can the women start to access all this?
Sure.
As you said.
You can come see us at our office and we can help you with that.
Absolutely.
That is one of the things that we do. So even if I have patients all the time that come in, not as many as the patients that are like, I'm miserable, help me. But I have patients that are like, I'm 40, I'm 42. I know that things are going to change. I want to get in front of this. And so we talk about what changes are going to happen naturally in their body and how to prevent those changes to a certain degree, but even to hedge against them. So for example, we will lose muscle mass. But what we can do right now in our 40s, 50s, even 60s is increase our protein, replace hormones as well, if that is something you choose to do, because that is very much tied to your bone and muscle mass. But building muscle mass, resistance exercises, we used to hear cardio.
Absolutely.
Well, cardio is important. It's important for your heart, okay, for it to be conditioned. But for overall health, maintaining your weight, and for longevity, your muscle mass is very important. And especially in the legs. So our legs are like thighs and buttocks, our biggest muscle group. So if those are strong and we've got plenty of muscle there, not only are we going to burn calories just sitting here talking, but we're also going to, guess what? We're not going to fall. If we do fall, we're going to catch ourselves. And if we don't catch ourselves, we're going to have that extra cushion and not break a bone. We're going to be on the floor playing with our grandkids. We're going to be the whippersnappers driving our friends around when we're 90 years old. So that starts now. That starts at 40, 50, years old. It's not too late if you're 70. Absolutely. Great studies that you can still change that parameter for longevity.
So I know we promised each other that we're gonna do on regular videos because the subject is really wide.
Yeah.
You do hormonal replacement therapy, and people usually have a question mark about this, like what age I can do when my hormones start to be iffy, or when I go through menopause. Or when should I? Is it too old to start after age 50? Is it young to start at age 40? And they're always afraid because there is always a spread rumor of, oh, you may have cancer if you do hormone replacement. So what do you say about that?
I would say that those 20, 25-year-old myths are old myths, and they were never true. So I have myself, I started hormone replacement with a very simple over-the-counter hormone called pregnenolone when I was 43, and that's the mothership hormone that makes everything else. I subsequently added on testosterone and now even estrogen. But in your 40s, by your 40s, a lot of women have lost a lot of their testosterone. Our testosterone is our most abundant hormone. We have 10 times more testosterone than we have estrogen in our bodies when we are in our reproductive years. So you can imagine the toll that that takes on you, and it's
That's
slowly
the fatigue and
decline.
the hair loss and the no sleep. Yes.
And the belly
Mm.
fat, and all of a sudden I'm softer. How am I softer? Well, because you've lost muscle mass and you've traded it for fat because of that loss. So that is something that's very easy to replace, as is estrogen, as your periods spread out or stop altogether. Bioidentical hormones, body identical, same structure that you have naturally, given to you in the right form, which might mean across the skin, underneath the skin, or whatnot. There are some things that are okay to take by mouth, but given in the right form, the right amount, the right dose is very much beneficial for you. And no, 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 it does not cause cancer. You can also go to our website at completemidlifewellness.com, and we have a beautifully written menopause hormone therapy, the facts, with references that are very current, and you can read those. You can take them to your doctor too. I just emailed it to a patient whose doctor was giving her 20-year-old advice. So it's okay. You know, people get confused. It's fine. People in my own profession still sometimes aren't current about things, but I assure you, if you're taking the right kind of hormones, that it is going to benefit your brains, your bone, your muscles, you know, everything, your skin, hair, nails, all of
Right.
it.
Right, because whatever we take care of, I mean, I know people are they spend a lot of money into skincare and all those over-the-counter vitamins and all
Yeah.
that, but they take it with no management. It's just and the gummy ones, the sugary gummy ones, it's
Yeah.
like it's a mind blower to how much it is in the market, and people are just eating it because it's vitamins, and it's
Yeah.
what do you think about that?
No, I do not like gummies. I have in general, because they are very high in sugar. They're high in artificial dyes. They're high in dextrose. And as a matter of fact, there's a fiber supplement that I recently found that was sugar free. But Dr. Susan and I just ordered a continuous glucose monitor, that because they've come over the counter. We're trying them out, and she already has hers. She tried out some sugar free gummies, and her blood sugar went up to 180, which is the highest it's ever been. And so it just goes to show you that these artificial sweeteners and things like that, they do just as much, if not more damage than actually just the plain old sugar. So if you're going to have something, have sugar, honey. If you want to have something that's a no calorie sweetener, stevia or monk fruit, that's what I use. But I have honey. But what I'm not eating is, you know, the saccharin, the NutraSweet, the sucralose, all of those things, because they're probably even worse. They kill the good bacteria, and they also stimulate the hormone in your brain for hunger, because your body senses sweet. It doesn't know the difference of it being a no calorie sweetener or not. So it's an issue. I do not like gummies for vitamins.
Thank you. I wanted to bring this up because I see people counters like filled of all kind of vitamins, from biotin to multivitamin to calcium, and it's just when I see it on the shelves, that's just that I don't like it at all.
You know, I get tired of taking pills too, so sometimes I'll take the capsule, if it's a capsule, and I'll twist it open and I'll pour it in my, you know, whatever it is that I'm drinking. So that is an option for most things too. Not everything, but most things. For supplements, not for medications.
So, but most of the services you provide, which is I'm benefiting from it personally, and I love the management you had given me, and it alerted me. I've been trying to be healthy. I've been trying to do the right things, but still, our body is missing main things: the stress and no sleep and all. So the management, the way that you managed my daily, helped me manage and think correctly with adding the supplements, the correct supplements that matches what I need, the deficiency I have and you saw in my labs. So people need to understand that they need to be followed by a professional person in order to really set you up with the correct supplements. And then the best of it is the hormone replacement therapy, which is I'm very much into it, and I thank you for helping me with it. I've been really for years trying to give the time to spend it. We are at the age where I need to be taking care of this, and it really changed my life. I sleep well. I feel my weight is managed easily. At this point, I used to struggle losing weight. Now my Pilates and my classes are making a difference. You recommended for me to add more muscles into the thighs area and all, and I'm seeing the difference. I'm seeing the toning difference, but I think it's not just because of my efforts, because of what you helped me with, the supplements, the fibers, the health living style, plus adjusting the hormones, which is I cannot control. It's our body that goes into menopause.
Yeah.
So, how much how long of a time before a woman can feel the difference once she step up to take care of her, or you start managing it?
You can literally go home that night and have better sleep. So many of us, and I mean, if I had $5 for every time someone said, "Oh my gosh, I'm sleeping, it's a miracle," I could, I don't know, buy a new Mini Cooper. But so the progesterone that we lack, like, it wreaks havoc on us, the low hormones, and just being able to replace that orally at night for, I would say, 90% of women makes a huge difference with their sleep. And so what do we get during our sleep? We get growth hormone, right? And so that helps our metabolism, and we reduce our cortisol, and that helps our metabolism and inflammation and the brain fog and everything else. But as far as estrogen and testosterone, depending on how you choose to replace that, meaning what method, via pellet or through the skin, in 2 to 4 weeks, and definitely by 6. I have many people come in for their 6-week, checkup, or even their 3-month checkup, and I can already see their muscle mass. In fact, I had a patient this week. She gained 4 pounds of muscle in 6 weeks.
Oh,
I
wow.
couldn't believe it. And I heard, she had just a really low normal testosterone level. And I was thrilled. It just goes to show you that you don't need these crazy testosterones that some people are giving women out there. It needs to be just normal physiologic. So I was super happy about
So it
that.
is
But not much time.
matching what we used to have.
Yeah.
It would be trying to match a person from 10 years ago, right? And help
Yes.
keep the level of it.
Absolutely. That's our goal anyway.
So can you explain to us a little bit about the pellet,
Sure.
the one that we put under the skin? How do you decide on that?
Oh, sure. Basically, I'll draw your blood, and some of it's experience, but let's say you have 0 estrogen or testosterone in your body, then I kind of do like a weight-based guide. And so I'll probably do about 1 milligram per kilogram for the testosterone, or I might do 1.5, depending on your activity and your muscle mass and things like that. And I always start on the conservative end, because I can give you more, I can't take away, right?
Yes.
And basically pellets are, I don't know if y'all can see this, but if you can see the tip of my pen,
Wow.
the estrogen pellet is about the size of the tip of my pen, and a testosterone is about this size, more extended. And it goes into a little device just like this, and you give some lidocaine and a tiny little incision, and then you just push it in underneath the skin, and it stays there, and it has blood vessels come around it over about 2 weeks, and then it slowly absorbs over 3 to 4 months, and then you repeat the process. So it's really simple. That's what I have in my body. It's been life-changing for me, but I'm the poster child for testosterone therapy for sure. But it's super convenient as well, and nice consistent levels for me.
All right. I know we said we're gonna keep the meeting for under 30 minutes, so we can post it on Instagram. I cannot see how long we've been. I think maybe close to 30 minutes, correct?
Close, yes.
So we want to do more meetings with you, educational, just like this one. I want to. I hope to educate through you women onto how to take charge of their life, and they need to think out of the box. They need to go and ask for more testing. They need to meet doctors that has the training you have. So what is the training that you have that different than a gynecologist?
Oh, well, sought out additional training in menopause and lifestyle and longevity medicine. And so I do have a certification with the Menopause Society and a certification with the Anti-Aging Academy. So, and then I read all the time, many hours a week.
Yeah, good. And I see your good habits. You're working hard on meeting it. And look at you. You look great, amazing.
Thank you.
On an Instagram and live, because I know you live. So, and I think it pays off.
It does. Thank you.
It does. So I'm gonna post after this a connection to your Instagram, because it's been really very educational. I love what you post. I love the conversation you have on your Instagram, and I'm just gonna advise, if anyone needs to have an appointment, we're more than happy to facilitate, or just contact your office directly for appointments. It's easy to get through. I love your staff, very helpful, knowledgeable, well trained. I really admire the supplements recommendations that you give after you do a full evaluation, choosing the right fibers, the right collagen. I think there's so much out there. So how do you choose those products?
Oh gosh, I research them and I test them on myself. So does Dr. Susan. We guinea pig out our staff. So we vet everything, procedures included, whether that's the O shots, Morpheus, Juliet, Encella, hair restoration. I mean, we try it all out because we want to make sure that it's okay.
Yeah. Yes. And you offer those services at your office.
Yes.
Okay. Well, thank you so much for your precious time. We really appreciate you. And we will send you any questions that anyone has. I think there was so many questions that I wasn't catching up, but I think you already caught up with it.
Okay.
I just removed the commenting because it was repetitive. So.
All right. Well, thank you. I'll see you next month.
All right. See you soon.
Bye.
Thank you. Bye-bye.